people under mandatory quarantine. Of the new positive cases, we know 27 had close contact to a positive case. 11 of them are healthcare workers, and 11 don't have a clear source of infection at this time. So these are things that we're going to continue to look at. And again, I was telling everyone you have to be patient, because when we're hitting these numbers, 200, 200, 200, it takes time to have them chase, or to call them to let them know they're positive, which they get notified too, and start doing the mapping and tracing, so to speak. So please be patient with us, and like I said, if you really want to help us out, start writing down where you were, who you think you might have exposed if you're around someone without a mask on, and where you visited, and anyone in your household. These are some of the basic questions our investigators are going to inquire when they talk to you, so we can try to stop the spread. So over the last 5 days, there's been an average of 200.8 new positive cases. Yesterday it was 201.2, so slightly down a little bit. As of today, 32,851 people now have completed quarantine. So I want to say that again, because we get a lot of questions. We do put out the good stuff. People are getting this. They are recovering. We do have people that are in quarantine, getting out of quarantine, doing the right stuff. But again, 32,851 people now have completed quarantine. Of those, 8,288 tested positive for the virus and have recovered, which is great numbers, 8,288. That's an increase of 359 recoveries since yesterday. So we do put out the recoveries. People are recovering from this. It is spreading. But the alarming thing is for us, there was 18, and this is the largest number we had, new hospitalizations overnight. So we're averaging between 12 and 15 new people going into hospital and people leaving, you know, and thank God that they're leaving, they're recovering and moving on, so to speak. But we do have an alarming number of people going into the hospital. There are currently 110 people hospitalized from the virus. Yesterday was 107, and the day before that was 113, which was our peak. We want to continue to see the downward trend with people staying in the hospital. We don't want people in the hospital. But unfortunately, we have 23 patients that are currently in the ICU, which is another record we've seen before. And yesterday it was 23, and the day before that was 21. So these are things we continue to monitor. We continue to monitor the Capital Region hospital capacity, which Dr. Venditti and them put out all the great stats, and the Albany Med, led by Dr. McKenna, basically let everyone know where they're at. But just to let you know, our hospital bed space is stable at roughly 25%, and our ICU beds are down to about 24%. So they're the things that Dr. Venditti talked about at Albany Med, and the things we have to continue to monitor. On our control room, Dr. Venditti was talking about basically the hospitalizations bed. But one of the alarming things we've been seeing the trend here in Albany County government is the amount of people that now, for whatever reason, are getting COVID-19 and are positive. So it's like a domino effect. One person gets it in the agency, and we have to shut down 17 people. The hospitals are having the same issues with their staff, because if you know, the new matrix that the Governor Cuomo put out is based on not just the matrix zones, but it's based on not hospital beds and ICU beds, but staffing. So even though Albany Med has a great plan in place with the other regional hospitals, if they don't have the staff for the beds, it defeats the purpose. So they're having the same issues we're starting to have in different agencies, because we have agencies that have never shut down. We have an obligation to deliver services that we have no choice but to come in. Water purification has to go to work every day to make sure you can flush your toilets. They can't stay home. You know, even from your DPW workers to your garbage people to your security to mental health and health, and I could go on and on and on. They have to come to work every day, and DSS has to come to work. But we have gotten our workforce well below 45% in a lot of agencies, but DSS has been a hard one to lower that number, because obviously our applications for SNAP, housing, everything else, assistance, is really continued to really grow leaps and bounds compared to last year. People need more assistance than ever before, so the stimulus package 5 is going to be welcome to help these people. So we need workers in the building. But we have made a conscious decision. I am going down to a skeleton crew to the best of my ability with people in Department of Social Services. And I will say this to everyone, you will still get your service. We will make sure. We might have a hiccup, but I can no longer afford to have that many people into a building. And we need to address that. And that's why I said to everyone, if you can, stay home. If your companies can do what you did 9 months ago and did it by sheltering in place and basically working from home or remote, please do that. Help us stop this. Help us stop the growth. We'll get through it. The vaccine's here, but it's going to take time. And we have to continue to operate differently. And the way county government operated 9 months ago is, I can assure you, a lot different now with the technology we added and everything else. But the safety of the residents of Albany County are first and foremost, and the workers. And I appreciate every worker that's come in every day here. I see it on your face. I know you've been working hard, and I appreciate every one of you for what you do here for county government to deliver the services to the people of Albany County that they're used to, and continue to give that quality of service. So I do think of you every day, and without you, we can't make services possible. So being smart, please wear your mask, cough into your hand, or your arm, excuse me, clean your hands, stay 6 feet apart. We'll get through this. We're going to get through this. The vaccines are getting through our nursing home. We get them Wednesday. Other nursing homes are getting them around the 26th. I actually was just talking to County Executive Steve McLaughlin this morning. His nursing homes are looking at the end of the month. We're going back with some stuff back and forth, so please keep that in mind. What's alarming is that and I can't, it's hard to believe with the holiday, the national news today reported that airports across the country are seeing an increase in traveling. I don't know what people didn't learn about Thanksgiving when they went out, and why we're in the situation we're in. And we need you to do the right thing and stay home. I just talked to the CEO of the Albany International Airport, Phil Calderon, and he's actually encouraging people not to travel. And for a CEO of an airport to say that says a lot. And I said, Phil, what's it look like? And he goes, you know what, we're probably looking at about 1,000 people today, and the numbers are really low. So we're not seeing what's going on a national level here in the Capital District as much. But typically they get 6,500 people on a daily going through the gates at Albany International Airport. And obviously at the travel time of the holiday, it's more. So I'm not happy we're seeing 1,000 people, and I don't think Phil's happy, because the only way we're going to get through this is if we work together. I know people have COVID-19 fatigue. I know you're tired. My staff's tired. Everyone's tired. People are a little bit crankier. It's the holidays. It's time to take a step back and appreciate the things around your life that you have in there, the good things, and stop focusing on the negative stuff. And we'll get through it. People should continue to get tested. We encourage that, whether you have signs or symptoms. I worked out. We're getting more testing. That announcement will be next week, the partnership that we announced, and we're going to bring it to you. The mobile testing sites were a huge success. We're one of the first ones to do it in the state, but we couldn't get people to come there. It was hard to get people to come to the mobile testing sites. Now we're going to come to your door. We're going to make it easier on you, and please stay tuned for that. And I'm working out the logistics, and it's a lot of partnerships, but we're going to make this happen so people can get tested, make it convenient, and make it simple. I don't know what else we can do, and we're not going to charge you for it. We're going to pay for it in the county. Going back and forth with Chairman Andrew Joyce, we're going to figure this out. And money can't be the issue for someone's health or to get through this health crisis. So working with the Albany County Legislature and the other partnerships I got going, we'll get this done. If you do need to get tested, please, the Times Union Center will be on tomorrow instead of Friday, like I said before. Whitney Young is going to be at the Ward of Fleet Administration Building. If you need to get tested or you feel like you just want to get tested, please call 518-465-4771. We pay for it. If you don't have insurance, we'll cover the cost. And also the state of New York, and I know I keep saying this, and somebody kept, why do you bring it up? Because obviously there's still people out there that don't realize if you don't have insurance, we'll either pay through for Whitney Young or Governor Cuomo set it up across the state where you can go get free testing and they don't charge you. You don't even take your health care, even if you have health care. So there's places available. And we can make this happen. So no one should have to worry about paying for this. I mean, not at these difficult times. So you can call the state to schedule an appointment at 1-888-364-3065. And again, our great partners with Price Shoppers, CVS, Purdy One, Walgreens, and plenty others I could continue on. Go to our website at albanycounty.com to see what tests and sites are available or closest to you for kids and all that. We get them questions still today. That's why we developed this. Please take the time to go to the website, and you can see where you can bring your child, or you can bring your mom or dad or your loved one, and the times that you're going to have to wait. And again, it's holiday, and we tend to see more people at the holiday time trying to get tested. So yes, there's going to be a backup, and it's going to take you a while to get tested, and you just got to keep that frame of mind. I want everyone to celebrate the holidays. I really do. We have Hanukkah, Kwanzaa, Christmas coming up on Friday, New Year's around the corner, and you know what? It's been a tough 9 months on everybody, and I realize that. And I've made the conscious decision with my staff, not unless something gets so far out of whack these next 2 days, not to do a briefing. We'll put a press release out. Not unless something if you hear from me Thursday or Christmas morning, it's just going to be because I have no other choice. But the reality is this: I want people to take a step back these next couple of days. It's the end of the year. Enjoy what's around you. Enjoy your loved ones. And if you don't have anyone you love, enjoy being with yourself for the next couple of days. I know we all need a break from the COVID-19 press conferences and then stuff putting out and negative, as people look at it, negative stuff coming at them. It's our job to educate you. It's our job to let you know what's going on. It's my job just to give you the facts, not my opinion, to tell you how it is and how we're reading it from the World Health or CDC or Governor Cuomo or Department of Health or whoever we're dealing with, to put that information out there. But my challenge is this to everyone. I still want you to do the right thing. I'm not telling you. I know we have COVID-19 fatigue, but here's a challenge to the viewers out there and to listeners. You know what? Take a break. Stay home. And enjoy everything in your life and think of the positive stuff. But if you do go out, wear your mask, cough into your arm, clean your hands, stay 6 feet apart, and don't have large social gatherings. We know there's a whole movement of people having house parties and getting together. I'm asking you, please don't. If you want to get through this until this vaccine gets out, it's only going to get worse. And I don't want to report another Albany County resident passed away, or someone else is in the hospital or the ICU. We have 3 people under the age of 25. I stopped reporting whether or not they have health conditions or not, because that's all people want to hear. Well, they had underlying health condition could be diabetes. It can be something small like high blood pressure, right? The last couple of people we had in their 50s had no underlying health conditions. And I'm not trying to scare people. I'm just trying to put the facts out there so you can educate yourself. So you can be part of the solution, not part of the problem, and we can get through this together. So please, these next couple of days, I am going to try not to put stuff out there that I don't have to, and I want people to take a break from this. Enjoy your neighbors, enjoy your family, enjoy your co-workers. Take some time. I am going to shut county government down to a level that's never been shut down, even 9 months ago. I am going to go to emergency status in the county, where I have limited skeleton crews to the best of my ability to keep people safe. Because again, what Dr. Venditti was saying, it's spreading, and we're having the same effect here with our workers. And I want to protect them as much as I want to protect residents. But I still have to deliver services. I still have to do certain things. So please, to the viewers and listeners, be patient. It's going to, you're still going to get whatever you need, and no one's going to be who's homeless. You're going to get shelter. People that need food, I can assure you as hell you're going to get your food, and you're going to be taken care of, and you're going to get clothing if you need it. You're not, though it just be a little bit slower process, and just give us time so I can protect my workers just as much as I'm trying to protect the residents. Enjoy the holidays. Enjoy the time that you have with people in your lives. And if you're mad at somebody, my wife said this to me, spread love, not hatred. And you know what? I'll say a prayer for the person that just wants to be negative all the time. I'm just trying to put the facts out there. So please take a step back. It's a marathon, not a sprint. We'll get through it. We're almost through it. I know it feels like we're going to hell and back, but we'll prevail. We always do. So if you need mental health support, please call the number. It's available 7 days a week, 8 a.m. to 5 p.m., 518-269-6634. And our 24-hour sexual assault hotline number, 518-447-7716. Our partnership with United Way, 211, and New York State hotline, 188-364-3065. And again, please just wear your mask. We'll get through this. Stay healthy and safe out there, and do the right thing. Any questions?
Yesterday, the hospital leaders all had a press conference to talk about vaccine distribution, and Albany Med was mentioned again as being the regional hub. They said they're putting together a task force with people around the region. Do you know of people from Albany County who are participating in that task force?
Yeah, I want to commend Dr. McKenna because they've never done this, and I know the Department of Health made it where these regional hubs. It's what I've said before. The Department of Health, that's their main function in crises like this. With the medical corps that we've had in place for over 50 years, they practice this, mass vaccines or getting drugs out there for worst case scenarios like this, which you hope never happen. It happened. So Dr. Whalen and her team have put a great plan together. We had to give to the federal government. We had to give to the state. We do it every year. You have to update your information. We have like sites like the Times Union Center would be a mass place to get shots. Other areas throughout the county, in Bethlehem, and I don't want to name the buildings because I don't want people thinking that that's where we're going. But there's buildings all over the county that we have established. Kind of threw us for a loop when it went to Albany Med, and it took it out of the control of the health departments. But it's a good thing, and it's a different approach, and we're making it work. So Dr. Whalen was part of that. Dr. McKenna did have her. I think she was the only health commissioner they have at the table to talk about our point of view and how we can help working together. And I commend Albany Med's hospital and the regional hospitals because, again, they've been on the forefront of this, and now they're going to be on the forefront of this getting the vaccine out. So it's working out, and I know they have some plans coming out. They're getting more stuff in quicker, so they're going to be moving more rapidly, and you'll see in the next couple days, I hope. I was hoping by today you're going to get an announcement that we're going to get more vaccine out to that next class of workers that need to get it.
And also, I know you've spoken with the Black Caucus quite a lot about vaccine distribution. Are they involved in the distribution planning process?
So they are here with the county, through our health department, through my office. We talked to Bill Clay and the leaders of the Black Caucus, and I want to do a PS commercial and really kind of put it out there so people get buy-in. It's just not a politician getting a shot in the arm. It's going to be people that look like them, that understand where they're coming from and why they don't believe in this, and educate them, and so we're working that out for the next couple of days. I know Albany Med, Dr. McKenna said that yesterday at his press conference. He's going to make sure. I know Dr. Whalen brought all that up to his attention. Albany Med's going to address it, but I just hope in the middle of this emergency we just don't bypass it quickly, that we do listen to the people, and we do hear and let them have a say on how they want this to go out to their communities.
What is your reaction to and position on the president's request for $2,000 instead of $600 per individual in this new package?
The more, look, I think they did a better job at identifying it and not just giving it to everyone. It has to get to the hands of the people that need it. And I would like to see them get 600, to the people that need it. I mean, and you can identify it. You look at our unemployment rate today versus a year ago, it's crazy. And more people are getting laid off. And again, come to our Department of Social Services, and you will see the services that we are providing. So it's a start. I wish this happened back in August. I wish this happened back in April when we were negotiating this fifth stimulus package. It took a long time. And one thing I will say about government, we need to act when the people need it, not debate and wait and debate and wait. I think the bill that just came out is like 600 and something pages. I could be wrong. There's a lot. The devil's in the details. But I will say I wish the people that need it got the $600 because it helps on a lot of ways. Not just for them pay the rent or pay the mortgage or put food on their table. When they go out grocery shopping, that means I'm getting sales tax revenue. When they go out and get gas, I'm getting sales tax. So it does have a benefit ripple effect to not just them, to everyone, and to the people that don't want to see that happen or get mad that someone's getting extra money, thank God you don't need it. Thank God you got a full-time job and benefits where you're not worried about a stimulus package and waiting on DC to do their job.
But specifically, the 2,000 compared to the 600, would you prefer to see the 2,000 as requested as opposed to the proposed 600?
I would like to see the best benefit for the people that they get. So the 600, if it's more long term, the 600, if it was, added into their checks again, if the 2,000, So yeah, I would like to see the one that benefits them the best.
Also, I missed an entire week because I was on vacation. Was there any updated guidance from the state on microcluster zones? It seems like the goalpost keeps shifting for yellow, orange, and red zones, and I'm not clear on what's happening here.
Right. That's what you get for going on vacation. I wish anyone else get vacation in this room. I don't think so. And it's a great question. And you know what? The microcluster zones, I think we've kind of gotten away from it in the capital region. The governor's looking at us at the hospital capacities. The State Department of Health's been looking at the hospital capacities, the ICU beds, the doctors, the nurses, the physicians, all that wrapped into one, whether or not what our capacity is. So that's why we're watching the hospitalizations more than just, we have 218 positive cases today, right? Which is high for us. But we're looking at the hospitalization, and that's why Dr. Venditti said yesterday, better than I can ever say it, that they are shifting elective surgeries. They're shutting them down to a degree. They will shut them down if they have to have the beds. But if he doesn't have the staffing for the beds, it defeats the purpose. So the microcluster zone's working in the other parts of the state. It's operating differently here because we would have been in the red zone 3 weeks ago. Based on our numbers. And our numbers are high, but compared to the rest of the state of New York, we're pretty low, which is good.
So that being said, I know everyone is concerned about restaurants and similar businesses as winter continues, but are we even looking at reductions at this point, since the governor is anticipating that a month from now we'll be on the downswing as opposed to the peak we're sort of reaching right now?
I don't want to put words in the governor's mouth, but I think what he's trying to do is not do a shutdown again, because it had different effects. Our suicide rate went through the roof. Drug overdoses went through the roof. People went back to using drugs that weren't that were in rehabilitation or fighting this alcohol or drugs. So it does have a different ripple effect that you don't see, or it's not popular to put out there. And people love social interaction. No one likes to be. My one brother-in-law loves this. He loves being away from people and not hugging anyone. And I won't call Kevin out on that. But I will say this. Most people want to be with people, and we have to be careful how we do this. And if we want to see these businesses survive through the winter, we got to figure it out. And that's why I said to people, please use. That's why we did that executive order for Grubhub and them, and we amended it to fix that too, because there was another loophole they had in there. So we just fixed that through the Department of Law, and I know the legislature is going to vote on that too. Is the fact that we have to get gift cards or pick food up from them. The capacity in restaurants are at 50. I think it's 25% right now, to be quite honest with you. So I don't see how they survive through the winter based on 25% capacity in a restaurant. So I'm saying to the viewers, stay safe, order food, pick it up, bring it home, support your local restaurants and businesses.
So is it fair to say in retrospect that back in March we should have used a precision tool as opposed to a hatchet when organizing how and when we were going to shut things down, because the numbers infection-wise are worse than they were earlier this year, but more things are open. So is it fair to say we did not approach this correctly back in March?
I have said this time and time again. It's easy to be a Monday morning quarterback, right? It's easy to wake up and saying you shoulda, coulda, woulda. The governor had to make decisions based on 30 seconds of information being thrown at him. And when you look at that, and it's just like, same thing with me. I hoped every decision that I made when I put my head on my pillow at night was the right decision, and that's why we closed down our nursing home and we did other things, and you shut government down because you're trying to protect the people. So dealing with this COVID-19 in the beginning, we didn't know how. It was different. We were dealing with it. It keeps morphing. It keeps changing. As we know now, UK has another strand of it, and we're worried about that coming here. You are right. Our numbers are a lot worse now than they were when we shut down. but we had a lot more people dying at mass numbers that we're still having people pass away. But in the beginning, we lost a lot of more New Yorkers then than we are now. And again, you change with the science, and you have the scientists and the health officials, not us, not the politicians, the health officials lay out how you can get through this. And again, they feel with the hospitalizations, the beds and the ICU beds, that we are now more prepared for it than before. But Dr. Venditti, look, I want people to come away with this press conference positive, but I have to say this. They are alarmed because they're seeing more hospitalizations, and they think it's going to be a lot higher than it was back then when we did shut down. I don't know if that answers your question or not.
And do you have a rough estimate of when you will be making this announcement about a new sports franchise coming to this area?
Hopefully soon. I shouldn't even say what I said before. I slipped. Nope, I slipped up. I did. That's what happens when you take live questions all the time. Tend to let your guard down a little bit. Any other questions? Again, please, everyone, wear your mask, cough into your arms, clean your hands, stay 6 feet apart, and stay safe out there. Thank you. Happy holidays, everybody. Merry Christmas.